What leave those marks that don't disappear forever.
Yes. You'll get the first dose today and the second dose you'll get after 8 weeks. And you make sure you get it because that you get total protection.
After that now I can throw away the mask.
No, you don't throw away the mask. Added protection.
Then what do you need?
It's to boost your immunity as we continue putting on the measures of protecting us against COVID-19.
Which gauge is that you want to use?
This is a
WHO specified
injection for immunization.
But which gauge is it? How big is it?
It's a standard gauge. It's a standard gauge. 32.
Only 2 parts.
Dunge waziri pia. We'll let me call you in 15 minutes. You might be able to
It is not time for
Hallelujah. Amen.
mimi nimeogopa kweli lakini nitadungwa.
Pigia makofi.
Pigia makofi.
Thank you, lady and gentlemen. I'm here together with the health team on behalf of the governor of Migori County to launch phase 1 of COVID-19 vaccination in the county. As you have witnessed, we have taken the jab and standing by here are frontline workers, the county healthcare workers in Migori County, who have also taken the jab alongside myself. And I want to urge the rest of our colleagues in the health department and the county at large to follow the queue and take the jab. It is for our own safety, and for those of us who have taken it, especially myself, I'm feeling safer than before. And I want to say that it is not a painful injection. I know there are people who have phobia to injection. This one is very soft, administered by very experienced nurses. So I want to urge you, even members of the Fourth Estate, after you've finished your work, we are leading you there so that you take your portion of the vaccine. Thank you. There shouldn't be any misconception, because remember when COVID-19 came in, those myths were there, the disease itself. There were people who thought it was a tonga, it was just something that cannot do anything. But later on, science was proven right. What the scientists said about the disease came to pass. Many people have died, many people fell sick, many people were quarantined. So to set the record straight, science never lies. The same applies to this vaccine. It has been developed by scientists as a response to this disease. And I would say that alone rules out any myth that anybody would be harboring. It has been taken by countries that are developed, countries that are even making this vaccine, and therefore nobody would risk the life of their people, because we know there are even presidents who have taken it. So those myths are misplaced, and nobody should listen to them.
However, now on report of on COVID, ladies and gentlemen, COVID cases, like we have had cases within our prison, GK prison, of which 24 cases were reported, and the isolation is being carried out there. We also had another 16 from Kameji High School. Those cases were identified by Luala community, and those ones are given home-based care. Even in school, they have an isolation center, which is, we'll say, is a big plus, because everybody is aware of what is going on. However, so far, since the inception, 1 year ago, we have had 12 deaths within the county. So this end, we are getting threatened because of our borders, and we are trying very much to work towards protecting our country, our people, from those coming from the neighboring country. So both us as health systems, health department, and national government, we are cooperating together so that we ensure that crossing borders through Panya routes is really, really controlled.
How many doses do we have here today? How many are we expecting? Then we have the myth that people who are vaccinated should not maintain social distance and things like that. What message do you have?
I think that's a very straight question. I will tell you that for Migori, we have received 9,000, but the rest remained in Kisumu. Here we received 4,500, which is kept in our store at Suna East, and will be used for the health workers in the first phase, and then the uniform workers also. Health workers will include everybody who is working within the health fraternity in Migori County, whether they're drivers, they're actual workers, they are all health workers, and they will be vaccinated. The myth should not be there. All the protocols will have to continue. All the protocols will have to continue. Wearing of masks, washing hands, and social distancing will always continue. So there is no myth about anything here. Let me just tell you that teachers will come last, yeah? But whoever we are targeting, say again, we are targeting?
So the teachers are among the frontline workers.
Yes.
When are we targeting them? In respect that we have cases of COVID in schools like
Yes.
So this one means that you need to reach teachers as far as
Oh, okay. What is happening is that teachers will come at the last team towards the end of this first phase of vaccination. And then, for us, we are going to cascade the training of trainers, TOTs. They are going to go around to the sub-county units to train people who will administer vaccination within those areas, so that not everybody will be coming here. We should be ready to go out and reach our people where they are. I think that's the question I was forgetting.
It's very important for the healthcare workers to take this vaccine because, you know, we are exposed to patients who are coming from outside. So I want to take this opportunity and really appreciate even the ministry for seeing to it that the healthcare workers became the first to actually receive the vaccine. So I feel that when the healthcare workers are vaccinated, we will be safe as we continue giving services to the clientele that will be coming to us. Yeah, as a person who is heading the vaccines and also the county nursing officer, nurses, of course, are the majority in the county, approximately 700 nurses. And of course, you realize that they do more of the services. So I just want to urge all the nurses here that please ensure that you take the jab. The jab is actually safe from the training that we've undergone. So please take it and protect yourself. Remember, the other measures will continue. Continue putting on your mask, continue social distancing, continue hand washing, which is very cost effective towards the prevention of COVID-19.